Good morning from the Oklahoma Insurance Department. My name is Wyatt Stanford, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you cannot reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now, I would like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you, Wyatt, very much for helping out this morning. Good morning, everybody. I hope everybody is staying warm. I don't exactly know what to wear anymore. It's warm, it's cold, it's warm, it's cold. Welcome to Oklahoma. Thank you for joining us this morning for our next installment of Medicare Mondays. To remind everybody, I am getting over here, there we go. The Medicare Assistance Program at the Oklahoma Insurance Department is funded through grants from the federal government that give us money to go out and educate the public about Medicare, what Medicare is, how it works, what are the different parts of Medicare, as well as how people can protect themselves from becoming a victim of fraud in the Medicare system, as well as also things that are available to help people afford their Medicare. If people are having trouble making ends meet, there are programs out there that can help people afford their medications as well as helping them pay their copays and such. So that's part of what our program is about. So let's go ahead and get started. Before we get started with our topic for today, it's that time of year again when we start gearing up for our next fraud prevention conference. These are held every year at MetroTech there on Lincoln Boulevard. It's on the corner of Spring Lake Drive is where they're at. And they're held in conjunction with the FBI, with the Oklahoma County Sheriff's Department. There's a lot of people that are involved in this, and we have speakers that are from the FBI, the Attorney General's office. It's held over 3 days. This year it's going to be June 13th, June 20th, and June 27th. We'll have more information about what hours exactly we're going to be holding those. The other thing to keep in mind is we're going to have listening centers across the state, places where people, if you don't live close to Oklahoma City, it might be more convenient for you to attend these events by going to one of those listening centers. So once we've got those listening centers around the state lined up, we'll be sure and post those so that maybe you can go to one of those locations and still participate via video in these events. So I would encourage you, stay tuned. Find out about that and become very aware of what are the fraud, the scams that are taking place right now. What are the things you can do to protect yourself? So more information to follow on that. So let's get into today's topic, preventive services. For some people, they're thinking, preventive services, not very sexy. Well, you know what, folks? This is a very, very, very important topic. In a nutshell, preventive services, these are those things, when Medicare first started, it was completely and totally focused on when you get sick. It only covered when you were ill and you went to the doctor and they would try and cure what was wrong with you. They did nothing to try and prevent you from getting sick. Then in around the 80s is when they first started covering some things that were preventive. And then around 2011 is when Medicare really got going in terms of looking at, hey, we've got to start keeping people healthy rather than just doing the locking the barn after the horse has been stolen kind of stuff. So what we're looking at is we're trying to prevent illness. We want to detect those medical conditions as early as possible and trying to keep people healthy. So the preventive services that we're talking about here, they include screenings, vaccinations, also counseling. There's a lot of the things that are available to people that don't necessarily involve getting stuck with a needle or an x-ray or something like that. They're just education. They're teaching people what are the things that we as individuals can do to improve our lives. Now, these apply not only for people who are just on traditional Medicare, but also for Medicare Advantage members. Anything that's covered by Medicare, Medicare Advantage plans are also required to cover. And when you think about it, when Medicare Advantage first started many, many, many years ago, that was kind of their basic premise, is they wanted to look at keeping people healthy. So why are these preventive services so important? Well, we know that early detection means that it's easier to treat something. If they can catch something in its very earliest stages, it's much easier to treat. It's much more effective to treat when something is first starting out. Also, the outcomes are much improved. When we were younger and we would get some injury or illness or something like that, our bodies were able to bounce back a lot better than they are when we get older. So it's much more important as we age to identify these things as early as possible so that we have a much better chance of recovering from any illness that we might have. So we have a better chance of doing better if we can catch those conditions early on and start treating them. We don't decay as much. And then, of course, the potential cost savings. If we can identify these conditions before they turn into something very disastrous, then it's much easier and it's much cheaper on the individual, as well as it's a cost savings for the Medicare system in general. So the cost of the preventive services. With original Medicare, if the U.S. Preventive Services Task Force, this is a body of professionals, if they say that a preventive service is recommended, that service is going to be covered at 100%. And what they look at is they look at what is the probability that that preventive service is going to identify that condition. And if this is a preventive service that's known to be very accurate, then chances are that's something they're going to recommend. So if they recommend this preventive service, then it's going to be covered at 100%. Now, if you're getting this service done, it's very important, just as with anything else you're getting done on original Medicare, you want to be trying to go to a participating provider. All right. If you go to a non-participating provider or a doctor who has opted out of taking Medicare, then you're going to be paying more money. So make sure you're going to a participating provider with Medicare. With Medicare Advantage plans, any preventive service that's covered at 100% by traditional Medicare has to be covered at 100% by the Medicare Advantage plan, as long as you are seeing an in-network provider. So again, it's very important that you make sure that the provider you're seeing is in-network for your Medicare Advantage plan. Now, under either coverage, there are certain criteria that you have to meet to be eligible to get these preventive services. Just because a preventive service is covered by Medicare doesn't mean that you necessarily qualify. There are certain criteria that you have to meet. Like, for instance, colonoscopies are a covered benefit, but only under certain circumstances, like every so many years, or if you're over a certain age. Things like that you need to be aware of. And in all the materials that are provided by Medicare, it outlines what that criteria is, as well as the fact that your doctor is very familiar with that criteria as well. Now, sometimes there could be a charge that's associated when you receive care. Let me give you an example. Let's say that you schedule a preventive, a screening colonoscopy, and you go in, you've never had any challenges, you've never had a problem before, but the doctor goes in and he's doing the colonoscopy, and lo and behold, he finds a polyp. Polyps can be precancerous. So at that moment, right then, that particular screening colonoscopy has now become a diagnostic colonoscopy. So that doctor is going to remove that polyp. They're going to have to send it off for biopsy. They're going to have to do a number of tests. So at that point in time, it's no longer covered at 100%. It's still covered at 80%, but it's diagnostic. The good news is they found it when they found the polyp and they removed it before it became something more concerning. And they were able to identify if it was cancerous in case you needed treatment. The same thing might be true for a screening mammogram. You went in, you weren't aware of any problems, but they might have found something concerning on the mammogram, which led those physicians to believe that you needed more treatment. So those are the circumstances under which it could switch from being a screening test to a diagnostic test. Again, the important thing is you're getting possible treatment that you might need to keep yourself from getting into a more serious situation. Also, in some situations, where you receive that screening service can have an effect on if you get charged. Some facilities, like if, for instance, if you're getting that colonoscopy at a hospital, that hospital may charge a facility charge. So you might want to check up front to see if the facility has that in place to see if you're going to have that facility charge. The other thing to keep in mind is, let's say that you're going to get some screening service done at the doctor's office. If the physician is also going to be doing some other service while you're there, if they're doing some other office visit type service, there could be a charge for the office visit. So just being aware of those charges ahead of time is important to know if you see something that pops up on your Medicare summary notice or your EOB. Now, let's talk a little bit about some of the specific preventive services that are covered by Medicare, because some of these also pop up in conversations that we have with some of the beneficiaries because they're confused about why they might see a charge on something. One of those being the Welcome to Medicare visit. Also, there's an annual wellness visit that's kind of similar to that. The Welcome to Medicare visit is a visit that is available to beneficiaries when they first start on Medicare. The idea behind the Welcome to Medicare visit is for those patients to go in and meet their doctor. A lot of people, especially seniors, we're not real good about going in and seeing our doctors. It's not the most enjoyable visit that a person wants to have. And so the goal is doctors need a baseline. Doctors need to know what you look like when you're healthy so that they can better assess if you possibly are sick when you come in. Not everybody is exactly the same. Some people's blood pressure normally runs a little higher than others, etc. So with a Welcome to Medicare visit, you're going to go in, they're going to check your height, your weight, and your blood pressure. They're going to look in your eyes. They're going to do a medical history. They're going to talk about where you live and what your social history is. Are you married? Do you live alone? Sort of things like that. They're going to talk about your home. They're going to talk about community safety and things like that. They're going to screen you for depression. They're going to ask you what you do to kind of keep yourself going and what are the things you do for fun and stuff like that. What they're not going to do is a full-blown physical. They're not going to do a lot of blood work. They're not going to do x-rays. They're not going to do a urine analysis. That's a physical. And that's outside the scope of that Welcome to Medicare visit. This is just to get an idea of where you are. One of the other purposes of the Welcome to Medicare visit is to identify what other preventive services you may need to get. You may not have had a colonoscopy ever, or it may be time for you to get another colonoscopy or a mammogram or some other preventive services that it's available. This gives that doctor the opportunity to say, okay, you probably are due for this and we ought to look at getting that. Now, you don't have to get these. When you meet with your doctor, if you don't want to, there's nothing that says you have to do it, but it gives you the opportunity to know what's available to you so that you can make that decision. Now, the annual wellness visit is very similar to the Welcome to Medicare visit. It's just the follow-up. It's a year later. It gives the doctor a chance to kind of assess where you are now, see if anything has changed, and maybe if you need something else, or for him to identify, maybe it looks like your blood pressure's gone up a little bit or something like that. Let's talk about vaccines. That's been a hot topic lately, hasn't it? Some vaccines, a lot of the vaccines are covered. All vaccines are covered. Okay. What's different is whether they're covered by your Medicare Part B as in boy or Part D as in dog. Let's talk about the ones that are covered by Part B. The flu shot, which has been around for a long time now, that's covered by Part B. Medicare Part B will cover one flu shot every flu season, and it is covered at 100%. The same is true with the pneumonia shot. It's covered at 100%. You need to talk to your doctor to find out. He's going to want to know what pneumonia vaccines you've already had in the past and stuff, but he'll help you identify if you need a pneumonia shot. Hep B, hepatitis B, that is also covered if you are at medium or high risk. That's going to be for people such as someone who has end-stage renal disease or hemophilia. If you live with someone who is a hepatitis B carrier, and there's some other criteria as well. Again, your doctor would be the one to tell you if you need to get a hepatitis B vaccine. The COVID-19 vaccine also is covered by Part B, and it is covered at 100%. Other vaccinations, things like your rabies shots and your tetanus shots, things like that, those have been covered by Part B for a long time now. Now, there are other vaccinations that are also commercially available that are covered, but they're covered by Part D, as in dog. One of those that's very important is the shingles vaccine. Up until a couple of years ago, people actually had to pay part of the cost or all of the cost for their shingles vaccines, and those were pretty expensive if you hadn't met your deductible yet. Now, you do not have to pay a copayment for commercially available vaccines, including the shingles shot. So there's no excuse for not getting your shingles vaccines, folks. It's a very painful condition. So I would encourage you, talk to your doctor, and if you're willing, get that shingles vaccine because it is covered at 100% now. So some of the most frequently used preventive services under Medicare. The cancer screenings, mammography, colonoscopies, pap tests and pelvic tests, those are all covered at 100%. Diabetes screenings, bone mass measurements. One of them that's not on here that sounds scary as all get out, but it's not, the aortic aneurysm screening, the cardiovascular disease screenings of various kinds, the annual wellness visit, all of these are covered at 100%. Now, there is a whole massive list of all the different preventive services that are available to individuals. You can go to medicare.gov. And on this website, you can go to that specific link, preventive screening services, and it will tell you what the screening service is. It will tell you how often it is available. It will tell you what the criteria is to see if you qualify to get that service. Also, if you've not done this yet, folks, if you're on Medicare, create a medicare.gov account, because that's a really good way to keep up with your preventive services. You can identify what do you need to get done and how often by using that medicare.gov account. And always, always, always work with your doctor on this stuff. Don't fly by the seat of your pants, as they say. Your doctor one of the purposes of that doctor is to kind of coordinate all of those services, to coordinate that care, to keep track of that stuff, and know what are those services that you need to get done, and to keep those records straight. So definitely work with your doctor to identify any of those preventive services that you might need. There are some really great publications that are out there that you can ask for. You can go to medicare.gov. You can request these. This is the cover of one of them that was just updated. I think it was in February of this year. But that's what it looks like. It's got all the preventive services in there, and they would be happy to send you a copy, or guess what? It's available online. So you can literally just Google this document and look at it online and go through what each one of those services are. Now, again, some of the services that are available are not so much a shot. They're not going to be a medical screening. Some of it is counseling. Some of it is teaching you things that you can do to make your life better. Some of it's just going to be evaluating what are the things you're doing? How are you living your life? Maybe you're one of these seniors that is not getting out of the house very much. Maybe you're sitting at home and you don't really think that's a problem, but maybe there's an opportunity for greater socialization. Maybe the doctor might suggest that you do some things to get out in public more, get involved, find a hobby, things like that, things that are going to keep you mentally in a better frame of mind, because the research has shown that if we have a better positive mental attitude, that also impacts our physical health. So that's another reason why looking into these things and paying attention and talking to your doctor can have a great impact, not just on the quality of your life, but the length of your life. Because again, they've shown that having that positive mental attitude can actually add time. Now, before we get to questions, I want to remind everybody, these are the agencies with whom we have a contract to provide the same services that we provide in our office in Oklahoma City. So these agencies cover these counties across the state. And of course, if there's some question that comes up or comes to them that they're unaware of or they don't know the answer to, they know to reach out to us. So please feel free to reach out to these folks, and they are happy to help you with this stuff. And so with that, let's see. Do we have any questions, Wyatt?
We have no questions as of right now. We can give them a couple of minutes.
Absolutely. I will point out that uh, with the Medicare Advantage plans, one point that I was going to put on that slide that I didn't put on there, some of the Medicare Advantage plans actually offer some additional preventive services. And for those preventive services, they're obviously covered by that Medicare Advantage plan, but if they're not one of the ones that's covered by Medicare, the Medicare Advantage plan can actually establish their own cost sharing. So it doesn't necessarily mean that that preventive service is going to be covered at 100%. It may actually have a copay that the Medicare Advantage plan has established for that particular preventive service. So be aware of that. It might be a great preventive service and it might be something that you're very interested in getting, but don't be surprised if it's not something that Medicare also covers. If you do have any questions about the preventive services and what's covered and what's not covered, or if you see a charge on your Medicare summary notice for something that you thought was going to be a preventive service, don't hesitate to give us a call. Our phone number is 1-800-763-2828, and talk to one of our counselors and say, I thought I was going in for preventive care and this is what happened. And as I said before, maybe they found something. Or the other thing to keep in mind is, let's say that you are a woman who has previously had a suspicious mammogram. If you've had a suspicious mammogram in the past, you're never going to have a screening mammogram again for the rest of your life. All of your mammograms from now on are going to be diagnostic because you've had a suspicious mammogram. So, and the same thing would be true for someone who's had a colonoscopy that has come up with polyps or something like that. The screening is gone. The screening is out the window. So from then on, they're all going to be diagnostic. The same thing would be true. Let's say that you've been going to the same physician now for 20 years and that you've got health conditions. Your doctor is very aware of your hypertension or your heart condition or a lot of those other things. If that's the case, and don't try making a wellness check with your doctor. Your doctor already knows you're not well. He's probably going to say, let's just continue doing the same blood work we do to check your hypertension and the blood work to make sure that all of those things that aren't supposed to be in there, that all your medicine's working correctly, they're going to have to do that stuff. So a wellness check's really not going to be something that's going to give you much help. So did I see any questions come in, Wyatt?
So we have one. How do we get a copy of the presentation?
I believe that the presentations are available on the website. Am I correct?
Yes, so all of our recorded webinars are available at map.oid.ok.gov as well as on the Oklahoma Insurance Department YouTube page.
Thank you, sir. All right. If nobody else has any questions, I do appreciate everyone's time. I want to make you aware next month we have got a special guest speaker that's going to be joining us. Our topic next month is going to be about the Quality Improvement Organization, Acentra. And rather than trying to tell you what all these acronyms mean, I'm just going to give you a little bit of an example. Let's say that you are in the hospital and you're on Medicare, and somebody comes in and says, well, good news, you're going home tomorrow. And you don't think you're ready to go home yet. You think you still need to be in that hospital for a little while longer. Who are you going to call? Well, you're going to call Acentra. Acentra is the QIO, the Quality Improvement Organization, that is there on your behalf to review the paperwork. They're going to look into it and see if maybe you do need to stay there longer. And if they agree with you, you actually will get to stay in the hospital and Medicare will continue covering it. So if that sounds like something you'd like to learn more about, please join us next month for our Medicare Monday and listen to our speaker, Nancy Job, who's been doing this for a long, long time. So hopefully you guys can join us, and I look forward to seeing you. Have a good day.